It's an amazing opportunity to speak to you guys today. As Rick's already introduced me, my name's Logan, and I'm a final year medical student at the University of Auckland. That's in New Zealand. And it's been, from what I've heard, it's been amazing to hear so many different perspectives on rare diseases. We've had stakeholders from pharma, we've had clinicians, we've had patients, or representatives of patients, and now you're going to hear the perspective of a medical student. So my background, just briefly, I did a BSc in biomedical science, then I entered medicine, and partway through medicine I did an intercalated degree in neonatal medicine. And I'm very honoured to be speaking here at the Royal College of Nursing. I'm also very glad that Findacure on the Medics for Rare Diseases thought that my essay, the ideas of my essay aligned well with their institution, so hopefully share some of that with you today. So this is a world map, and that's New Zealand. I know that John Oliver did a segment a couple of days ago probably about how New Zealand keeps getting left off the world map, so there it is. Maybe we should make it a bit more central so people don't forget about it. You know, all you other countries are so big. And this is not what the University of Auckland looks like. That's Hobbiton. So I just wanted to start my talk off with this picture. So this is the letter that I got when I found out that I didn't get into medical school the first time I applied. And I think that was quite a defining moment in my life. And it's certainly something I hold at the front of my mind during my medical studies now. I was talking to the other essay winners, and during medical school you tend to get caught up in, you know, remembering all the therapies, all of the pathophysiology of diseases, and it's quite hard to remember that there was a time where you were striving to get into medical school because of the opportunities that were available to you in the first place. So this is like a nice reminder for me to remember the amazing opportunities that are available to us as medical students and in the health profession at large. So when this email came around promoting the rare diseases essay competition, I thought to myself, you know, that would be quite a cool thing to enter, and you know, £100 cash, that's pretty good, conversion rate double, so $200 in New Zealand. Yeah, I could do with that money. But at the time, this was in 2017, I couldn't think of anything to write about. And so I put a reminder in my phone for rare diseases essay in September the following year. And 2018 rolled around, September, October, and I saw this. And the question that really stood out to me was the second question. And it is, living with a rare disease is a lifelong learning experience in which patients become experts in their own disease. Use a case study to demonstrate what future doctors can learn from patients with rare diseases. All the questions were amazing, but I chose this question just because of the humanistic components that answering the question would entail, and I thought that I had a pretty good experience that I could write about. So the title of my essay, Repurposing a Rare Opportunity, talks about my experience with a young boy, 5-year-old, with Worcester-Drought syndrome. And so earlier in 2018, I met this boy on my paediatrics attachment in a small rural hospital in the central North Island of New Zealand, so pretty close to where Hobbiton is. And I thought that that was the last place I'd actually see a patient with a rare disease. And as part of the paediatrics attachment in our 5th year, we are asked to write a case report about a patient with a chronic illness. And in my search for a patient with a chronic illness, I found CS. It was a 5-year-old boy, and he had Worcester-Drought syndrome. I'm not going to go into what that is, because I don't think it's necessary. And I met his mother in the emergency department. And he'd come to see us because his mum had noticed a change in the seizures that he was having after he'd had a fall. It was eventually found out that he had a subdural hematoma from the fall and had to be transferred up to Auckland, which is the tertiary centre for neurosurgery, to have it drained. So it's quite a complex case, in part because of the water drought syndrome, and the investigative work of the paediatric team was made a lot easier by this young boy's mother. Before meeting this young boy, I had no idea what water drought syndrome was. It's not one of those common illness scripts that you hear when you're in medical school. And I was so overwhelmed by how much I didn't actually know about water drought that I basically froze after introducing myself as a student. So, hi, my name's Logan, I'm a fifth year medical student. She said, oh, would you like to hear about my son's journey? I said, oh, perfect, thank you very much, that's exactly why I'm here. And I assume that so many of my predecessors in the paediatric detachment had also gone to this mother to hear about his journey. So despite being briefed by one of the foundation year doctors about this boy, I still fumbled around the past medical history. I was asking about all the different seizure types that this young boy had. I was writing arrows from one end of the page to the other, trying to connect all the dots. I was so determined to understand this complex puzzle that had been put before me. But it was only after TS, this young boy's mum, until she volunteered all this information about the psychosocial aspects that she had encountered, that I realized the bias I had towards the biomedicine. And one of the examples that has really stuck with me is the challenges that she faced as a mum, watching her son grow up and achieve these developmental milestones. So for parents, it's an amazing thing when your kid can take their first steps and get the strength to lift themselves up. But for this mum, it meant that her son could climb out of the cot and he was mobile and he was having seizures and falls. And so his bedroom wasn't a safe place. They moved into the lounge where they slept on mattresses. The lounge was devoid of all furniture. The curtains were always closed just in case he had a fall against the glass. The curtains would protect him. There were even mattresses up against furniture and window railings just so that he wouldn't hit his head on anything sharp. And undoubtedly, such information would be extremely important in the management of in the synthesis of a management plan and being able to help them at home. So that really put into perspective how much I'd been biased towards the biomedicine, and I thought to myself, why is that? Because even though I acknowledged this bias, it would be quite negligent to just stop there and not understand why. So in terms of the medical curriculum, I thought there's quite a focus on the disease model of illness, where disease is defined as a purely pathophysiologic process. You know, when we think of an illness in that sense, we neglect all the things that happen at home, how they are going to interact or function within society at large, and that has a real impact. So for this young boy, we tried to implement all these seizure medications, but one fundamental thing that we didn't do was offer him protective headwear. And so it was ultimately the lack of protective headwear that led to this admission and his journey to the Tertiary Centre for Neurosurgery. In terms of the more systemic things, it was harder to think of something, but rare illnesses were once considered, health orphans. Not much was known about them. They were considered rare, and so the health profession didn't do too much to help these patients and their families. And in order to get interest amongst the health professionals, governments incentivized research into therapies for rare illnesses. And some of the incentives that they offered were acceleration through a marketing process, subsidies in terms of tax. So this generated a lot of interest from pharmaceutical industries. So it's good that we have so much interest from the therapeutic side of things. I've heard some amazing talks today. But we need to think why there's been so much interest in only the therapeutic side of things. This is not to say that the drug companies aren't interested in helping out the patients with rare illnesses. This is just to say that it's easier for them to help out because these incentives make it easier to do so. So we need to think, why haven't we developed such incentives for the health professionals to focus on the psychosocial aspects of these patients' care? And we know that the socio-political organisations have the capacity to do so because the incentivisation of therapies has been so successful. So given all of that, I think we need to ask ourselves, who is really making the decision about the future of patients with rare illnesses? I think it's very good to see that patients are so involved in this conference setting, but I'm not too sure if that is if that's the norm. And we need to make sure that stakeholders, both therapeutics, medical, socio-political, are all aligned with each other and with patients as well. And so how can we achieve unison between all the stakeholders when patients and families with rare diseases are so marginalised? And we're starting here by giving patients a voice. For me to be able to voice CS and TS's journey has been extremely special, all the way from New Zealand as well. I think medical students automatically coupling rare diseases with biomedical minutiae. It's all too easy to hone in on all the details that we don't know. And if it were not for this young boy's mother bringing to my attention the psychosocial aspects of her care, I probably would have continued down the rabbit hole and lost sight of the bigger picture and denied myself the opportunity to think about the care in a more holistic aspect. So that's my story, and I hope that, sounds like the other medical students that are here have definitely learnt from the families that they interacted, and I hope that medical students and other health professionals can learn from the CSs and TSs of the world. Thank you.